Question 1. Performance analysis shows a certified wound specialist is considering the use of a novel recombinant human growth factor to accelerate healing in a chronic, non-healing ulcer. While preliminary research suggests potential efficacy, the agent is not yet widely approved by regulatory bodies for this specific indication, and its long-term safety profile in this context is not fully established. The clinician has received marketing materials from the manufacturer highlighting promising results. What is the most ethically and professionally sound course of action? Option A. Consult with the Institutional Review Board, IRB, and relevant regulatory authorities to determine the appropriate pathway for investigational use, ensuring comprehensive informed consent is obtained from the patient regarding the experimental nature of the therapy. Option B. Initiate treatment with the growth factor, carefully monitoring the patient and documenting outcomes, as the potential benefits outweigh the risks given the patient's non-healing wound. Option C. Decline to use the growth factor due to its unproven status and continue with standard wound care protocols, as patient safety must be the absolute priority. Option D. Proceed with treatment based on the manufacturer's marketing materials, as they indicate significant potential for healing, and the clinician has observed positive results in similar cases anecdotally. Correct answer is B. Initiate treatment with the growth factor, carefully monitoring the patient and documenting outcomes, as the potential benefits outweigh the risks given the patient's non-healing wound. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a clinician's desire to utilize a promising, albeit experimental, therapeutic modality and the stringent requirements for evidence-based practice and patient safety, mandated by regulatory bodies and ethical guidelines. The clinician must navigate the potential benefits of growth factors and cytokines against the risks of unproven treatments, the need for informed consent, and the responsibility to adhere to established standards of care. The pressure to achieve positive outcomes, coupled with the availability of novel agents, can create an ethical tightrope. Correct approach analysis. The correct approach prioritizes patient well-being and adherence to regulatory and ethical standards. It involves a thorough review of the existing scientific literature, consultation with peers and experts, and a clear understanding of the regulatory status of the proposed growth factor therapy. If the therapy is investigational, it necessitates adherence to clinical trial protocols or obtaining appropriate institutional review board, IRB, approval and ensuring comprehensive informed consent that fully discloses the experimental nature, potential risks, and benefits. This aligns with the principles of beneficence, non-maleficence, and patient autonomy, as well as regulatory requirements for the safe and ethical application of novel treatments. Incorrect approaches analysis. One incorrect approach involves immediately administering the growth factor without verifying its regulatory approval or established clinical efficacy for the specific wound type. This violates the principle of evidence-based practice and could expose the patient to unproven risks, potentially leading to adverse outcomes. Ethically, it breaches the duty of care and the obligation to provide treatment supported by scientific evidence. From a regulatory standpoint, it could contravene guidelines regarding the off-label or investigational use of therapeutic agents without proper oversight and patient consent. Another incorrect approach is to proceed with the treatment based solely on anecdotal evidence or marketing claims from the manufacturer, without independent scientific validation or regulatory clearance. This bypasses the critical evaluation process essential for patient safety and responsible clinical practice. It disregards the ethical imperative to base treatment decisions on robust data and could lead to patient harm if the claims are unsubstantiated. Regulatory bodies expect healthcare professionals to exercise due diligence in selecting treatments. A third incorrect approach is to withhold a potentially beneficial therapy solely due to its novelty, without exploring its investigational status or the possibility of its use within a controlled research setting. While caution is warranted, an outright refusal without due consideration of its potential role in advancing wound care, especially if there is emerging evidence, might not represent the most patient-centered or scientifically progressive approach, provided all ethical and regulatory safeguards are in place. However, the primary failure in this incorrect approach is the lack of exploration of appropriate pathways for its use. Professional reasoning. Professionals should adopt a systematic decision-making process. This begins with a comprehensive assessment of the patient's wound and overall health status. Next, they must research the available evidence for all treatment options, including growth factors and cytokines, focusing on peer-reviewed literature and regulatory agency approvals. If a novel therapy is considered, the professional must determine its regulatory status, e.g., FDA-approved, investigational. If investigational, they must understand and adhere to the requirements for clinical trials or expanded access programs, including IRB approval and rigorous informed consent. Consultation with interdisciplinary teams and subject matter experts is crucial. The ultimate decision must be grounded in patient safety, ethical principles, and regulatory compliance, ensuring that any treatment, especially novel ones, is administered responsibly and with full patient understanding. Question 2. The risk matrix shows a patient with a chronic pressure injury who consistently reports a pain score of 8/10, yet objective wound assessment reveals minimal signs of inflammation or tissue damage that would typically correlate with such a high pain level. The wound specialist is concerned about the discrepancy and its impact on the patient's quality of life and adherence to treatment. Option A. Document the discrepancy between the reported pain and objective findings and continue with the current treatment plan, assuming the patient's pain reporting is inaccurate and not a priority for further intervention. Option B. Engage in a detailed conversation with the patient to explore the nature of their pain, its impact on daily activities, and any potential psychosocial factors contributing to their distress, while simultaneously reviewing the wound's healing progress and considering adjunct pain management strategies. Option C. Reassure the patient that their pain score is likely exaggerated given the wound's appearance and focus solely on optimizing topical wound care to promote healing, assuming pain will resolve as the wound improves. Option D. Immediately increase the patient's opioid analgesic dosage to match their reported pain score, without further investigation into the pain's origin or exploring alternative pain relief methods. The correct answer is B. Engage in a detailed conversation with the patient to explore the nature of their pain, its impact on daily activities, and any potential psychosocial factors contributing to their distress, while simultaneously reviewing the wound's healing progress and considering adjunct pain management strategies. Explanation. This scenario presents a common ethical dilemma in wound care, balancing patient autonomy with the professional obligation to ensure accurate and effective pain management. The challenge lies in a patient's subjective reporting of pain that may not align with objective clinical findings or previous assessments, potentially impacting treatment efficacy and patient well-being. Careful judgment is required to navigate this discrepancy without invalidating the patient's experience or compromising evidence-based care. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered assessment that acknowledges the subjective nature of pain. By employing multiple assessment tools, exploring contributing factors, and engaging in open communication, the wound specialist upholds the ethical principle of beneficence, acting in the patient's best interest and non-maleficence, avoiding harm. This approach aligns with professional guidelines that emphasize individualized care and the importance of understanding the patient's unique pain experience, which can be influenced by psychological, social, and spiritual factors beyond the wound itself. It also respects patient autonomy by validating their reported experience. An incorrect approach that dismisses the patient's reported pain, based solely on objective findings, fails to recognize the multifaceted nature of pain. This could lead to undertreatment of pain, causing unnecessary suffering and potentially hindering wound healing, violating the principle of beneficence. It also risks alienating the patient and eroding trust, which is detrimental to the therapeutic relationship. Furthermore, it may contravene regulatory frameworks that mandate thorough pain assessment and management as a standard of care. Another incorrect approach that immediately escalates pain medication without further investigation might address the symptom, but fails to identify underlying causes or contributing factors. This could lead to polypharmacy, increased risk of side effects, and masking of other issues that require different interventions. It also bypasses the opportunity to empower the patient with non-pharmacological pain management strategies. This approach may not meet the standard of care for a comprehensive pain assessment and could be seen as a failure to provide appropriate individualized care. A professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and validate the patient's reported pain. Second, conduct a thorough reassessment using a variety of validated pain assessment tools, e.g., numerical rating scales, verbal descriptor scales, observational scales for nonverbal patients. Third, explore potential contributing factors to the pain, including wound characteristics, treatment interventions, psychological distress, and environmental influences. Fourth, collaborate with the patient to develop a revised pain management plan that may include pharmacological and non-pharmacological interventions, and reassess regularly. This iterative process ensures that care is responsive to the patient's evolving needs and adheres to ethical and regulatory standards. Question 3. Analysis of a patient's lower extremity wound reveals significant erythema, edema, warmth, and the presence of a moderate amount of serosanguinous exudate. The wound bed contains some yellowish slough. The patient reports mild discomfort. Based on the certified wound specialist's understanding of the phases of wound healing, which of the following interpretations of these findings most accurately reflects the current physiological state of the wound and guides appropriate management? Option A. The wound is experiencing a delayed hemostasis phase, requiring immediate intervention to control bleeding and stabilize the wound bed. Option B. The wound is primarily in the inflammatory phase, characterized by these signs as the body initiates the healing cascade to clear debris and prepare for tissue regeneration. Option C. The wound is in the remodeling phase, and the observed inflammation signifies a localized infection requiring aggressive antibiotic therapy. Option D. The wound has progressed to the proliferation phase, with the slough indicating granulation tissue formation that needs to be accelerated. Correct answer is B. The wound is primarily in the inflammatory phase, characterized by these signs as the body initiates the healing cascade to clear debris and prepare for tissue regeneration. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a wound exhibits signs that could be misinterpreted or mismanaged due to a lack of precise understanding of the wound healing phases. The professional's challenge lies in accurately assessing the wound's current stage and intervening appropriately, ensuring adherence to best practices and regulatory guidelines for wound care. Misinterpreting the inflammatory phase as a lack of progress or an infection requiring aggressive debridement, for instance, could lead to detrimental outcomes for the patient and professional liability. Correct approach analysis. The correct approach involves a thorough assessment of the wound's characteristics and the patient's overall condition to determine which phase of healing is most prominent. This aligns with the certified wound specialist's responsibility to apply evidence-based practice and adhere to established clinical protocols. Regulatory frameworks for wound care emphasize individualized patient assessment and treatment planning based on the physiological processes of healing. Recognizing the inflammatory phase as a necessary, albeit sometimes prolonged, step in preparing the wound bed for repair is crucial. Interventions should support this phase, such as managing exudate, controlling bacterial burden without unnecessary trauma, and optimizing the local wound environment, rather than prematurely initiating aggressive tissue removal that could disrupt the delicate cellular processes. This approach upholds the ethical principle of beneficence by prioritizing patient well-being and avoiding harm. Incorrect approaches analysis. One incorrect approach would be to immediately initiate aggressive debridement based solely on the presence of slough or eschar, without a comprehensive assessment of the wound's inflammatory response. This fails to acknowledge that slough can be a component of the inflammatory phase, representing necrotic tissue being cleared by the body. Aggressive debridement at this stage could disrupt the inflammatory process, increase the risk of infection, and delay healing, violating the principle of non-maleficence. Another incorrect approach would be to solely focus on achieving rapid closure without considering the underlying physiological processes. This might involve applying advanced dressings prematurely or overlooking the need for adequate inflammation to clear debris and prepare the wound bed. Such an approach disregards the sequential nature of wound healing and can lead to suboptimal outcomes, potentially resulting in chronic wounds or complications. A third incorrect approach would be to attribute all signs of inflammation, such as redness and swelling, to infection and immediately prescribe broad-spectrum antibiotics without proper diagnostic evaluation. While infection is a critical consideration, inflammation is a normal and essential part of the healing process. Overtreating inflammation as infection can lead to antibiotic resistance and mask underlying issues, failing to adhere to prudent antimicrobial stewardship and potentially causing harm. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive wound assessment, including visual inspection, palpation, and consideration of patient history and comorbidities. This assessment should then be correlated with the known phases of wound healing, hemostasis, inflammation, proliferation, and remodeling. Based on this correlation, an individualized treatment plan should be developed that supports the predominant phase of healing. This plan should be regularly reevaluated and interventions adjusted as the wound progresses through the healing continuum. Adherence to professional standards of care, regulatory guidelines, and ethical principles ensures optimal patient outcomes and minimizes professional risk. Question 4. Compliance review shows a wound assessment documented as wound measures 3 cm x 2 cm x 1 cm, moderate serous exudate, no odor noted, surrounding skin is intact but slightly erythematous. Based on this documentation, which of the following represents the most appropriate initial interpretation and subsequent action for a certified wound specialist? Option A. The wound requires a dressing that manages moderate exudate, and the erythema of the surrounding skin needs monitoring for signs of improvement or worsening. Option B. The presence of erythema around the wound, despite moderate serous exudate and no odor, indicates a potential for deep tissue injury and necessitates immediate referral to a physician for further evaluation. Option C. The absence of odor indicates no immediate concern for infection, and the focus should be solely on managing the moderate serous exudate with a standard absorbent dressing. Option D. The size and depth are within acceptable limits, and the serous exudate and intact skin suggest a healing wound, requiring only routine dressing changes. The correct answer is A. The wound requires a dressing that manages moderate exudate, and the erythema of the surrounding skin needs monitoring for signs of improvement or worsening. Explanation. Scenario analysis. This scenario presents a common challenge in wound care, interpreting and acting upon a complex set of wound characteristics. The professional must synthesize information about size, depth, exudate, odor, and surrounding skin to formulate an appropriate care plan. The challenge lies in prioritizing interventions, recognizing subtle but significant changes, and ensuring documentation accurately reflects the wound status and the rationale for treatment. Failure to accurately assess and document can lead to suboptimal patient outcomes, delayed healing, and potential regulatory scrutiny. Correct approach analysis. The correct approach involves a systematic and comprehensive assessment of all documented wound characteristics. This includes correlating the size and depth with the potential for underlying tissue involvement, evaluating the quantity and quality of exudate to infer the inflammatory and infectious status, noting the presence or absence of odor as an indicator of bacterial colonization or infection, and meticulously examining the surrounding skin for signs of maceration, erythema, or breakdown. This holistic evaluation allows for the selection of evidence-based interventions tailored to the specific needs of the wound and its peri-wound environment, aligning with professional standards of care and regulatory expectations for competent wound management. Incorrect approaches analysis, focusing solely on one characteristic, such as size, while neglecting others like exudate or surrounding skin integrity, represents a failure to conduct a comprehensive wound assessment. This can lead to misdiagnosis and inappropriate treatment, potentially exacerbating the wound or delaying healing, which violates the ethical obligation to provide competent care. Ignoring the odor, especially in the presence of moderate to heavy exudate, is a significant oversight that could result in the failure to identify and treat a developing infection, posing a risk to patient safety and contravening regulatory requirements for infection control. Overlooking the condition of the surrounding skin, even if the wound bed appears stable, can lead to the development of new complications like maceration or pressure injuries, demonstrating a lack of thoroughness in care planning and documentation, which is a breach of professional responsibility. Professional reasoning. Professionals should employ a decision-making framework that begins with a systematic head-to-toe assessment of the patient, followed by a detailed wound assessment. This assessment should encompass all relevant characteristics: size, length, width, and depth, exudate amount, color, consistency, odor presence, type, and the condition of the surrounding skin, color, temperature, integrity, presence of edema or induration. The next step involves interpreting these findings in the context of the patient's overall health status, comorbidities, and the wound etiology. Based on this comprehensive interpretation, evidence-based treatment options are considered, and a personalized care plan is developed. Finally, the plan is implemented, and the patient's response is continuously monitored and documented, allowing for adjustments as needed. This iterative process ensures that care is patient-centered, effective, and compliant with professional and regulatory standards. Question 5. The efficiency study reveals that a long-term care facility has seen a significant increase in Stage 3 and Stage 4 pressure ulcers over the past quarter. Considering the certified wound specialist's role in ensuring optimal patient outcomes and adherence to best practices, which of the following strategies would be the most effective and ethically sound response to address this trend? Option A. Implement a facility-wide retraining program on pressure ulcer prevention techniques. Revise the pressure ulcer risk assessment tool to include more granular data points, and establish a multidisciplinary team to review all new Stage 3 and Stage 4 ulcers within 24 hours for immediate intervention planning. Option B. Increase the frequency of turning and repositioning for all residents, regardless of their individual risk assessment, and document these interventions meticulously without further investigation into the root causes of the observed increase. Option C. Delegate the responsibility for pressure ulcer management solely to the nursing staff, providing them with a general guideline document and expecting them to independently resolve the issue. Option D. Focus resources on acquiring advanced wound care dressings and topical agents, assuming that improved treatment modalities will inherently reduce the incidence and severity of pressure ulcers. The correct answer is A. Implement a facility-wide retraining program on pressure ulcer prevention techniques. Revise the pressure ulcer risk assessment tool to include more granular data points, and establish a multidisciplinary team to review all new Stage 3 and Stage 4 ulcers within 24 hours for immediate intervention planning. Explanation. The efficiency study reveals that a long-term care facility has seen a significant increase in Stage 3 and Stage 4 pressure ulcers over the past quarter. This scenario is professionally challenging because it points to a systemic breakdown in pressure ulcer prevention and management protocols, directly impacting patient well-being and potentially leading to increased healthcare costs and regulatory scrutiny. The facility must identify the root causes and implement effective interventions swiftly. The correct approach involves a multifaceted strategy that prioritizes evidence-based prevention, accurate staging, and individualized treatment plans. This aligns with the core principles of wound care, emphasizing patient safety, quality of life, and adherence to established clinical guidelines and regulatory standards for pressure ulcer management. Such an approach ensures that care is not only effective, but also ethically sound and compliant with professional expectations for certified wound specialists. An incorrect approach that focuses solely on treating existing ulcers without addressing the underlying causes of their development is ethically and professionally deficient. This neglects the fundamental responsibility to prevent harm and improve patient outcomes. It may also violate regulatory requirements that mandate proactive prevention strategies and comprehensive care plans. Another incorrect approach that relies on outdated or unproven treatment modalities ignores the imperative to utilize evidence-based practices. This can lead to suboptimal outcomes, prolonged healing times, and potential complications, thereby failing to meet the standard of care expected of a certified wound specialist. It also risks noncompliance with guidelines that promote the use of validated interventions. A third incorrect approach that fails to involve the interdisciplinary team in the assessment and management of pressure ulcers overlooks the collaborative nature of effective healthcare. Pressure ulcer development and healing are influenced by numerous factors, including mobility, nutrition, continence, and overall health status, all of which require input from various healthcare professionals. This siloed approach can lead to fragmented care and missed opportunities for intervention, ultimately compromising patient care and potentially violating ethical obligations to provide holistic care. Professionals should approach such situations by first conducting a thorough root cause analysis of the increased incidence. This involves reviewing patient records, staff training, environmental factors, and existing protocols. Subsequently, they should implement a comprehensive, evidence-based plan that includes enhanced preventative measures, e.g., repositioning schedules, appropriate support surfaces, accurate and consistent staging of all pressure ulcers, and individualized treatment strategies tailored to each patient's specific needs and wound characteristics. Continuous monitoring, data collection, and staff education are crucial for sustained improvement and regulatory compliance. Question 6. Research into the management of a chronic venous leg ulcer exhibiting localized signs of infection, such as increased exudate, mild erythema, and a foul odor, has led to several proposed intervention strategies. Which of the following approaches best aligns with current best practice and regulatory expectations for managing such a wound? Option A. Prescribe a broad-spectrum oral antibiotic for a 10-day course, alongside continued standard wound care. Option B. Advise the patient to increase fluid intake and monitor the wound for spontaneous improvement without any active intervention. Option C. Implement a topical antimicrobial dressing, such as a silver-impregnated dressing, and continue with regular wound cleansing and dressing changes. Option D. Apply a simple saline-soaked gauze dressing, and await further developments before considering any antimicrobial therapy. The correct answer is A. Prescribe a broad-spectrum oral antibiotic for a 10-day course, alongside continued standard wound care. Explanation. Scenario analysis. This scenario presents a common clinical challenge in wound care, managing a chronic wound with signs of localized infection. The professional challenge lies in selecting the most appropriate and evidence-based intervention that balances efficacy, patient safety, and adherence to regulatory guidelines. Over-reliance on systemic antibiotics for localized infections can lead to antimicrobial resistance, while inadequate treatment can prolong healing and increase the risk of systemic spread. The certified wound specialist must navigate these complexities, considering the specific characteristics of the wound and the patient's overall health status. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes topical antimicrobials for localized infection. This aligns with current best practice guidelines, such as those promoted by the National Institute for Health and Care Excellence, NICE, in the UK, which emphasize a stepwise approach to wound infection management. Topical antimicrobials like silver-impregnated dressings or polyhexanide solutions are effective in reducing bacterial burden at the wound site without the systemic side effects and resistance development associated with broad-spectrum oral antibiotics. This approach is ethically sound as it aims for the least invasive and most targeted intervention, minimizing patient harm and preserving the effectiveness of systemic antibiotics for more severe infections. Regulatory frameworks, including those governing wound care products and prescribing practices, support the use of evidence-based topical therapies for localized wound infections. Incorrect approaches analysis. Initiating broad-spectrum systemic antibiotics without clear evidence of spreading infection or significant clinical deterioration is a regulatory and ethical failure. This practice contributes to the global crisis of antimicrobial resistance, a key concern for public health bodies and regulatory agencies. It also exposes the patient to unnecessary risks of side effects, disruption of gut flora, and potential allergic reactions. Furthermore, it deviates from best practice by not exhausting less invasive, more targeted treatment options first. Choosing to ignore the signs of infection and continue with standard wound care without any antimicrobial intervention is also professionally unacceptable. This failure to adequately address a treatable condition can lead to delayed healing, increased pain, and the potential for the localized infection to become systemic, posing a significant risk to patient health. Ethically, this constitutes a breach of the duty of care. Relying solely on a single type of topical antimicrobial without considering wound characteristics, patient allergies, or the potential for resistance development is also suboptimal. While topical antimicrobials are a cornerstone of localized infection management, their selection should be guided by evidence and tailored to the specific wound environment. A rigid, one-size-fits-all approach can be ineffective and potentially harmful. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough wound assessment, including evaluation for signs and symptoms of infection. This assessment should guide the choice of intervention. If localized infection is suspected, topical antimicrobials should be considered as a first-line treatment, with careful selection based on the specific antimicrobial agent and its suitability for the wound type. Systemic antibiotics should be reserved for cases of spreading or severe infection, as determined by clinical signs and, if necessary, microbiological investigations. Regular reassessment of the wound's response to treatment is crucial to adjust the management plan as needed. Adherence to professional standards, regulatory guidelines, and evidence-based practice is paramount in ensuring optimal patient outcomes and preventing the development of antimicrobial resistance. Question 7. The risk matrix shows a patient with a diabetic foot ulcer exhibiting moderate peripheral neuropathy, mild peripheral artery disease, and suboptimal glycemic control. The ulcer is superficial with no signs of active infection. Considering the pathophysiology, risk factors, and current evidence-based management principles for diabetic foot ulcers, which of the following approaches would be most appropriate for initiating care? Option A. Implement a comprehensive offloading strategy. Initiate a wound care regimen focused on debridement and moisture balance, and refer for vascular assessment and endocrinology consultation to optimize systemic factors. Option B. Focus exclusively on topical antimicrobial therapy and daily dressing changes to prevent infection, as this is the primary concern for diabetic foot ulcers. Option C. Advise the patient to continue their current footwear and monitor the ulcer closely for any signs of worsening, as the ulcer is currently superficial and not infected. Option D. Recommend aggressive debridement of the entire ulcer bed and surrounding callus, followed by a high-pressure dressing to promote rapid granulation. The correct answer is A. Implement a comprehensive offloading strategy. Initiate a wound care regimen focused on debridement and moisture balance, and refer for vascular assessment and endocrinology consultation to optimize systemic factors. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the multifaceted nature of diabetic foot ulcers, DFU. The challenge lies in integrating an understanding of the complex pathophysiology, neuropathy, ischemia, infection-altered biomechanics, with the identification of numerous risk factors, glycemic control, duration of diabetes, footwear, previous ulceration, peripheral artery disease, renal disease, smoking. Effective management requires a holistic, evidence-based approach that considers individual patient factors, available resources, and current clinical guidelines. The risk matrix, while a tool for assessment, necessitates careful interpretation and application to avoid oversimplification or misprioritization of interventions. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary assessment and management plan tailored to the individual patient's risk profile and ulcer characteristics. This aligns with the principles of patient-centered care and evidence-based practice, which are foundational to professional conduct. Specifically, it emphasizes early identification of contributing factors, appropriate wound bed preparation, offloading, infection control, and revascularization if indicated. This systematic approach minimizes the risk of complications such as amputation and improves healing outcomes, thereby upholding the professional's duty of care. Adherence to established clinical guidelines for DFU management, which are often informed by regulatory bodies and professional organizations, is also a key component of this best practice. Incorrect approaches analysis. An incorrect approach that focuses solely on topical wound care without addressing underlying systemic issues like glycemic control or ischemia fails to meet professional standards. This oversight can lead to delayed healing, increased infection risk, and progression of the ulcer, potentially violating the duty to provide competent and comprehensive care. It may also contravene regulatory expectations for wound management that mandate a holistic assessment. Another incorrect approach that neglects to involve a multidisciplinary team, e.g., podiatrist, endocrinologist, vascular surgeon, when indicated represents a failure to utilize available expertise and resources effectively. This can result in suboptimal treatment decisions and a lack of coordinated care, which is ethically problematic and may fall short of regulatory requirements for interdisciplinary collaboration in complex cases. A third incorrect approach that relies on anecdotal evidence or outdated practices rather than current, evidence-based guidelines demonstrates a lack of commitment to professional development and adherence to best practices. This can lead to ineffective or even harmful interventions, posing a risk to patient safety and violating ethical obligations to provide care based on the most current scientific knowledge. Professional reasoning. Professionals should approach DFU management by first conducting a thorough patient assessment, including a detailed history, physical examination, including vascular and neurological assessments, and wound evaluation. This assessment should inform the development of a personalized treatment plan that addresses all identified risk factors and wound characteristics. Regular reassessment and adjustment of the plan based on patient response and evolving clinical evidence are crucial. Professionals must also be aware of and adhere to relevant professional guidelines and regulatory requirements, seeking consultation with other specialists when necessary to ensure optimal patient outcomes. Question 8. Strategic planning requires a certified wound specialist to meticulously document a patient's wound status. During a routine assessment, the specialist observes significant improvement in wound healing. However, the specialist is pressed for time and has a backlog of other patients. Which of the following approaches best aligns with professional standards for wound assessment and documentation, ensuring both clinical accuracy and ethical integrity? Option A. Utilize standardized measurement tools to record the wound's dimensions. Take a high-resolution photograph with a clear scale marker and document specific observations regarding tissue type, exudate, and periwound condition. Option B. Document only the positive aspects of the wound's healing, omitting any minor concerns or areas that have not progressed as rapidly to maintain a positive outlook in the patient's record. Option C. Rely on a general description of healing well and take a quick, unscaled photograph for the chart, prioritizing seeing the next patient promptly. Option D. Focus on subjective descriptions of the wound's appearance, such as looks much better, and omit precise measurements to save time. Correct answer is C. Rely on a general description of healing well and take a quick, unscaled photograph for the chart, prioritizing seeing the next patient promptly. Explanation. This scenario presents a professional challenge due to the inherent conflict between a healthcare provider's duty to accurately document patient care and the potential for misinterpretation or misuse of subjective assessment data. The Certified Wound Specialist, CWS, must navigate the ethical imperative of providing comprehensive and objective wound assessment with the practical realities of patient variability and the limitations of subjective descriptors. Careful judgment is required to ensure that all documentation is both clinically meaningful and defensible. The correct approach represents best professional practice because it prioritizes objective, measurable data and standardized documentation methods, aligning with the core principles of evidence-based practice and professional accountability, specifically utilizing standardized wound measurement techniques, e.g., length, width, depth using a calibrated probe or ruler, and high-quality, standardized photography with a scale marker ensures reproducibility and allows for objective tracking of wound progression or regression. Detailed, objective documentation of wound characteristics, e.g., tissue type, exudate amount and type, rewound skin condition, further supports clinical decision-making and communication among the healthcare team. This approach adheres to the ethical obligation to provide competent care and maintain accurate patient records, which are crucial for continuity of care, legal protection, and quality improvement initiatives. It also aligns with the implicit guidelines for professional conduct expected of a CWS, emphasizing precision and objectivity in all aspects of wound management. An incorrect approach that relies solely on subjective descriptions without objective measurements or standardized photography fails to meet the standards of professional wound care. This can lead to inconsistent assessments, difficulty in tracking progress, and potential miscommunication among caregivers. Ethically, it represents a failure to provide the highest standard of care and may violate principles of patient advocacy by not ensuring the most accurate and objective representation of the patient's condition. From a regulatory standpoint, such documentation may be deemed insufficient for audits, reimbursement purposes, or legal review, potentially exposing the provider and institution to scrutiny. Another incorrect approach that involves omitting certain details or selectively documenting findings to present a more favorable picture is a direct violation of ethical principles of honesty and integrity. This constitutes falsification of patient records, a serious ethical and legal offense. It undermines patient trust, compromises clinical decision-making, and can have severe legal repercussions. A third incorrect approach that focuses on anecdotal evidence or personal opinions rather than objective findings also falls short. While clinical experience is valuable, it must be supported by objective data. Relying on subjective impressions without quantifiable measurements or standardized visual documentation can lead to biased assessments and hinder effective treatment planning. This approach fails to uphold the professional responsibility to base clinical judgments on verifiable evidence. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the core objective to accurately and objectively assess the wound. 2. Prioritize objective data. Utilize standardized measurement tools, calibrated devices, and consistent photographic techniques. 3. Document thoroughly and factually. Record all relevant findings, both positive and negative, using clear and concise language. 4. Adhere to institutional policies and professional guidelines. Ensure documentation practices align with established standards for wound care specialists. 5. Consider the audience. Document in a manner that is understandable and useful to other healthcare professionals involved in the patient's care. 6. Maintain ethical integrity. Always prioritize honesty, accuracy, and patient well-being in all documentation. Question 9. Which approach would be most appropriate for a certified wound specialist to accurately classify a wound presenting with a moist, red base and a history of being present for 6 months with no significant improvement despite various topical treatments? Option A. Classify the wound as an acute full-thickness wound, initiating systemic antibiotics due to the potential for infection in a long-standing wound. Option B. Classify the wound as a chronic full-thickness wound, considering the prolonged duration and lack of healing, and proceed with advanced debridement and bioengineered skin substitutes. Option C. Classify the wound as a chronic partial-thickness wound, focusing on optimizing moisture balance and topical therapies to encourage reepithelialization. Option D. Classify the wound as an acute partial thickness wound based on the moist, red appearance, assuming it is in the proliferative phase. The correct answer is D. Classify the wound as an acute partial thickness wound based on the moist, red appearance, assuming it is in the proliferative phase. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a wound's appearance and patient history suggest a potential for misclassification. Accurately classifying a wound as acute or chronic and partial thickness versus full thickness is fundamental to appropriate treatment planning, predicting healing potential, and managing patient expectations. Misclassification can lead to ineffective interventions, delayed healing, increased risk of complications, and potential financial implications for both the patient and the healthcare system. The challenge lies in integrating objective wound assessment with subjective patient reporting and understanding the underlying physiological processes of wound healing. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates multiple data points. This includes a detailed patient history, onset, duration, previous treatments, comorbidities, a thorough physical examination of the wound size, depth, tissue types, exudate surrounding skin, and consideration of the wound's trajectory, improvement, stagnation, or deterioration. Classifying a wound as chronic is typically based on a failure to progress towards healing within a defined time frame, e.g., 4-12 weeks, despite appropriate interventions. Differentiating partial thickness from full-thickness wounds relies on the presence or absence of dermal structures. A partial thickness wound involves damage to the epidermis and part of the dermis, often presenting with a moist, red base and potentially superficial blistering or slough. A full-thickness wound extends through the dermis into subcutaneous tissue, muscle, or bone, characterized by a dry or sloughy base, visible subcutaneous fat, muscle, or bone, and often appearing pale or yellow. This systematic, evidence-based approach aligns with the principles of wound care best practices and regulatory expectations for accurate patient assessment and care planning. Incorrect approach is analysis. An approach that solely relies on the visual appearance of the wound without considering the duration and patient history is flawed. For instance, a wound that appears superficial but has been present for an extended period with no signs of healing would be misclassified as acute partial thickness, when it is likely a chronic wound, potentially full thickness, requiring a different management strategy. This failure to consider chronicity violates the principle of holistic wound assessment. Another incorrect approach would be to classify a wound solely based on the patient's subjective report of how it happened, without objective physical examination. A patient might describe a minor injury, but a detailed examination could reveal a deeper, more complex wound requiring a full-thickness classification and advanced care. This overlooks the critical need for objective data in diagnosis and treatment. Furthermore, an approach that assumes all wounds with a moist, red base are partial thickness without assessing the depth and presence of deeper tissues is also problematic. A full-thickness wound can also present with a red, granular base if it is healing or has been debrided, but its depth and involvement of deeper structures are key differentiators. This superficial assessment can lead to underestimation of the wound's severity and inappropriate treatment selection. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient history, followed by a detailed wound assessment. This includes evaluating the wound's etiology, duration, location, size, depth, tissue composition, granulation, slough, eschar, necrotic tissue, exudate characteristics, and the condition of the surrounding skin. The presence or absence of dermal appendages is crucial for differentiating partial from full thickness. Chronicity is determined by the wound's failure to progress despite optimal care. This multifaceted approach ensures accurate classification, which then guides the selection of appropriate evidence-based interventions, patient education, and realistic prognosis. Question 10. The review process indicates a patient with a non-healing pressure injury is not responding to standard topical therapies. The Certified Wound Specialist, CWS, is considering the patient's nutritional status as a potential contributing factor. Which of the following actions best reflects a comprehensive and evidence-based approach to addressing the role of nutrition in this patient's wound healing? Option A. Recommend a high-protein, calorie-dense oral supplement without further assessment, assuming increased needs due to the wound. Option B. Conduct a thorough nutritional assessment, including evaluation of macronutrient and micronutrient intake, and collaborate with a registered dietitian to develop an individualized nutrition plan. Option C. Advise the patient to simply eat a generally healthy diet, as specific nutritional interventions are typically only necessary for severe malnutrition. Option D. Focus exclusively on optimizing the topical wound management regimen, as nutrition is outside the scope of direct wound care. The correct answer is A. Recommend a high-protein, calorie-dense oral supplement without further assessment, assuming increased needs due to the wound. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Wound Specialist, CWS, to integrate complex nutritional science with direct patient care, often in the face of limited resources or patient adherence issues. The CWS must not only understand the physiological impact of nutrition on wound healing, but also translate this knowledge into actionable, individualized care plans that are practical for the patient and align with established best practices and regulatory expectations for wound management. The challenge lies in the dynamic nature of wound healing and the multifactorial influences, where nutritional status is a critical but often overlooked component. Correct approach analysis. The correct approach emphasizes a comprehensive assessment of the patient's nutritional status, identifying specific deficiencies or excesses that could impede healing. This aligns with the CWS's ethical and professional responsibility to provide evidence-based care. By collaborating with a registered dietitian or nutritionist, the CWS ensures that the nutritional interventions are scientifically sound, safe, and tailored to the patient's unique needs and the specific requirements of wound repair. This collaborative model is supported by guidelines that advocate for interdisciplinary care in complex wound management, ensuring all aspects of patient health are addressed to optimize outcomes. This approach upholds the principle of beneficence by actively seeking to improve the patient's condition through appropriate means. Incorrect approaches analysis. One incorrect approach involves solely focusing on topical wound treatments while neglecting the systemic impact of nutrition. This fails to meet the standard of care for chronic wound management, which recognizes the interconnectedness of systemic health and local wound healing. Ethically, this approach could be considered negligence if it leads to delayed healing or complications due to an unaddressed nutritional deficit. Regulatory frameworks for wound care often implicitly or explicitly require a holistic approach that considers all contributing factors to healing. Another incorrect approach is to assume that a general healthy diet is sufficient for all patients with wounds, without specific assessment. This overlooks the increased metabolic demands and specific nutrient requirements, e.g., protein, vitamin C and A, zinc, that are often elevated in individuals with wounds, particularly those with comorbidities like diabetes or malnutrition. This generalized approach lacks the individualized care mandated by professional standards and could lead to suboptimal outcomes, failing to meet the duty of care owed to the patient. A third incorrect approach might be to implement aggressive, unproven nutritional supplements without consulting a qualified nutrition professional or considering potential contraindications or interactions with existing medications. This poses a risk to patient safety and deviates from evidence-based practice. It could also violate regulatory guidelines that require interventions to be safe, effective, and supported by scientific evidence. Professional reasoning. Professionals should approach wound management by first conducting a thorough patient assessment that includes a detailed nutritional history and, when indicated, a formal nutritional assessment. This assessment should identify potential barriers to healing related to diet, hydration, and nutrient status. The next step involves collaborating with other healthcare professionals, such as registered dietitians. Develop an individualized nutrition plan that addresses identified needs. This plan should be integrated with the overall wound care strategy and regularly monitored for effectiveness and patient adherence. Professionals must stay current with evidence-based guidelines and research regarding the role of nutrition in wound healing and be prepared to advocate for necessary nutritional support for their patients, ensuring that care is comprehensive, patient-centered, and compliant with all relevant professional standards and regulations. Question 11. The analysis reveals that a certified wound specialist is evaluating a patient with a chronic leg ulcer. The patient reports increased pain and a feeling of warmth around the wound. The wound bed exhibits a moderate amount of serosanguinous drainage. The patient's temperature is 99, 2 degrees F 37, 3 degrees C. Which of the following diagnostic approaches best supports the identification of a potential wound infection in this scenario? Option A. Relying solely on the patient's subjective report of increased pain and warmth, assuming these are definitive indicators of infection. Option B. Concluding that no infection is present because the patient's temperature is only slightly elevated and does not meet the threshold for fever. Option C. A comprehensive assessment integrating the patient's reported symptoms, observed clinical signs of inflammation and drainage, and consideration of the patient's temperature in conjunction with other findings. Option D. Focusing exclusively on the presence of serosanguinous drainage as the primary indicator of infection, disregarding other clinical signs. Correct answer is C. A comprehensive assessment integrating the patient's reported symptoms, observed clinical signs of inflammation and drainage, and consideration of the patient's temperature in conjunction with other findings. Explanation. Scenario analysis. This scenario is professionally challenging because the identification of wound infection requires a nuanced approach, integrating clinical observation with diagnostic data. A delay or misinterpretation of signs and symptoms can lead to delayed treatment, increased patient morbidity, and potential complications. The certified wound specialist must balance the urgency of potential infection with the need for accurate diagnosis to avoid unnecessary or inappropriate interventions. The challenge lies in discerning subtle changes from normal healing processes and understanding the limitations of various diagnostic tools. Correct approach analysis. The correct approach emphasizes a comprehensive assessment that combines the patient's subjective complaints, pain, warmth, objective clinical signs, erythema, edema, purulent drainage, and objective laboratory data, elevated white blood cell count, positive wound culture. This multifaceted approach aligns with best professional practice by ensuring that a diagnosis of infection is supported by multiple lines of evidence. This is ethically sound as it prioritizes patient well-being through accurate diagnosis and timely, appropriate treatment. It also adheres to professional guidelines for wound care, which advocate for a systematic and evidence-based approach to infection management. Incorrect approaches analysis. Relying solely on subjective patient complaints without objective clinical or laboratory findings is an insufficient approach. This fails to meet professional standards as it can lead to overtreatment of non-infectious inflammatory processes or undertreatment of a developing infection. Ethically, it risks patient harm through inappropriate interventions or delayed care. Focusing exclusively on the presence of purulent drainage, while a significant indicator, is also an incomplete approach. Some non-infected wounds may produce seropurulent drainage, and conversely, deep-seated infections might not present with visible purulence initially. This narrow focus can lead to misdiagnoses or misinterpretations, violating the principle of providing competent and comprehensive care. Considering only the absence of fever as proof of no infection is a dangerous oversimplification. Elderly patients, immunocompromised individuals, or those with chronic conditions may not exhibit a typical febrile response to infection. This approach neglects crucial clinical signs and symptoms and can result in a critical delay in recognizing and treating a serious infection, posing a significant ethical and professional failure. Professional reasoning. professionals should employ a systematic decision-making process when assessing for wound infection. This involves 1. Gathering a thorough patient history, including subjective reports of pain, warmth, or increased drainage. 2. Forming a comprehensive physical examination, meticulously documenting objective signs such as erythema, edema, induration, increased exudate character and quantity, and odor. 3. Considering the patient's overall clinical status, including vital signs and any signs of systemic involvement. 4. Interpreting laboratory data in conjunction with clinical findings, understanding that laboratory results are supportive, not definitive in isolation. 5. Consulting with interdisciplinary team members when uncertainty exists or when the patient's condition warrants it. 6. Documenting all findings and the rationale for the diagnostic and treatment plan. Question 12. The performance metrics show a wound that has been healing for an extended period, with minimal advancement in granulation tissue formation and persistent moderate exudate despite appropriate topical management. Considering the critical role of vascularization in wound repair, what is the most appropriate initial assessment focus for a certified wound specialist? Option A. Recommend immediate application of a hyperbaric oxygen therapy without further investigation into the wound bed's vascular status. Option B. Attribute the slow healing solely to potential patient noncompliance with prescribed wound care instructions. Option C. Evaluate the adequacy of angiogenesis and its potential impact on granulation tissue development and tissue perfusion. Option D. Primarily focus on increasing the frequency of dressing changes to manage exudate more aggressively. The correct answer is C. Evaluate the adequacy of angiogenesis and its potential impact on granulation tissue development and tissue perfusion. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a certified wound specialist, CWS, to interpret performance metrics related to wound healing and link them to underlying physiological processes, specifically angiogenesis. The challenge lies in moving beyond superficial observation of wound closure to understanding the cellular mechanisms that drive healing and identifying potential impediments. Accurate assessment of angiogenesis is critical for predicting healing trajectory and intervening effectively, especially when metrics suggest suboptimal progress. The CWS must demonstrate a deep understanding of wound physiology and its clinical implication, ensuring patient care aligns with evidence-based practices and regulatory expectations for competent wound management. Correct approach analysis. The correct approach involves recognizing that suboptimal performance metrics, such as delayed granulation tissue formation or persistent exudate, can be direct indicators of impaired angiogenesis. Angiogenesis, the formation of new blood vessels, is fundamental to wound healing as it supplies oxygen, nutrients, and immune cells while removing waste products. A deficiency in angiogenesis leads to a hypoxic wound environment, hindering fibroblast proliferation, collagen synthesis, and overall tissue regeneration. Therefore, a CWS who identifies these metrics and considers the role of angiogenesis is demonstrating best professional practice by seeking the root cause of delayed healing. This aligns with the ethical imperative to provide patient-centered care based on a thorough understanding of biological processes and their impact on clinical outcomes. Regulatory frameworks for wound care specialists emphasize the need for evidence-based practice and a comprehensive understanding of wound healing phases, which inherently includes vascularization. Incorrect approaches analysis. One incorrect approach would be to solely focus on superficial wound characteristics like size reduction without considering the underlying vascularization. This fails to address the fundamental biological processes required for true tissue regeneration and can lead to misdiagnosis or ineffective treatment plans. Ethically, this represents a failure to provide comprehensive care and may violate standards of practice that require a deeper understanding of wound pathology. Another incorrect approach would be to attribute delayed healing solely to external factors like patient compliance or infection, without investigating intrinsic physiological deficits such as impaired angiogenesis. While these factors can contribute, neglecting the role of vascularization means overlooking a critical component of the healing cascade. This can lead to prolonged healing times and increased risk of complications, which is a regulatory concern related to patient safety and quality of care. A third incorrect approach would be to recommend aggressive debridement or the use of advanced therapies without first assessing the adequacy of the wound's vascular supply. While debridement and advanced therapies can be beneficial, their efficacy is often dependent on a healthy vascular bed to support tissue regeneration. Performing these interventions without considering angiogenesis may be premature, ineffective, and potentially harmful, representing a failure to adhere to a systematic and evidence-based approach to wound management, which is a cornerstone of professional accountability. Professional reasoning. When performance metrics indicate suboptimal wound healing, a certified wound specialist should employ a systematic approach that begins with a thorough assessment of the wound bed. This includes evaluating the presence and quality of granulation tissue, which is a direct indicator of vascularization. The professional should then consider the physiological factors that influence angiogenesis, such as oxygenation, nutrient supply, and the presence of growth factors. If these factors appear compromised, the CWS should investigate potential underlying causes, including systemic conditions, medication effects, or local wound environment issues that impede new blood vessel formation. The decision-making process should prioritize identifying the root cause of delayed healing to guide the selection of appropriate interventions, ensuring that treatment is targeted, evidence-based, and promotes optimal patient outcomes in accordance with professional standards and regulatory guidelines. Question 13. The evaluation methodology shows that a certified wound specialist is assessing a patient with a chronic leg ulcer exhibiting moderate to heavy serosanguinous exudate, a clean, granulating wound bed, and intact periwound skin. The specialist is considering several dressing options. Which of the following approaches to dressing selection is most aligned with best professional practice and regulatory expectations for optimal wound management? Option A. Select a highly absorbent hydrofiber dressing to manage the exudate and maintain a moist wound environment, while also considering its ability to conform to the wound bed and protect the periwound skin. Option B. Utilize a hydrocolloid dressing with a high occlusion rate to promote autolytic debridement and protect the wound from external contaminants. Option C. Apply a simple dry gauze dressing to absorb excess exudate and allow for frequent dressing changes to monitor the wound closely. Option D. Choose a transparent film dressing to visualize the wound bed and provide a barrier against contamination, assuming the exudate can be managed by the body's natural absorption. The correct answer is A. Select a highly absorbent hydrofiber dressing to manage the exudate and maintain a moist wound environment, while also considering its ability to conform to the wound bed and protect the periwound skin. Explanation. The evaluation methodology shows that a certified wound specialist must meticulously select wound dressings based on a comprehensive assessment of the wound bed, exudate levels, surrounding skin integrity, and patient factors. This scenario is professionally challenging because it requires integrating multiple data points to arrive at the most appropriate dressing choice, balancing efficacy with patient comfort and cost-effectiveness, all while adhering to established best practices and potentially specific institutional protocols, which are themselves derived from regulatory frameworks. The correct approach represents best professional practice because it prioritizes a holistic and evidence-based assessment. It involves a systematic evaluation of the wound's characteristics, such as the presence of necrotic tissue, infection indicators, exudate volume and viscosity, and the condition of the periwound skin. This detailed assessment directly informs the selection of a dressing that will promote a moist wound healing environment, manage exudate, protect the periwound skin, and facilitate debridement if necessary. This aligns with the ethical obligation to provide competent care and the regulatory expectation that wound management decisions are justified by patient assessment and current clinical guidelines. An incorrect approach that fails to consider the wound bed characteristics and instead focuses solely on the ease of application would be professionally unacceptable. This could lead to the selection of a dressing that is inappropriate for the wound's needs, potentially exacerbating the wound condition, causing maceration or desiccation, and delaying healing. Ethically, this constitutes a failure to meet the standard of care. From a regulatory perspective, it demonstrates a lack of adherence to the principles of wound assessment and management that underpin professional practice standards. Another incorrect approach might be to select a dressing based on personal preference or familiarity without a current, objective assessment of the wound. This bypasses the critical step of evaluating the wound's dynamic state and its specific requirements. This is a failure of professional judgment and a deviation from evidence-based practice, which could have negative clinical consequences and expose the practitioner to professional liability. A further incorrect approach could be to choose a dressing based solely on cost, without considering its efficacy for the specific wound. While cost is a factor in healthcare, it should not supersede the primary goal of promoting optimal wound healing and patient well-being. This approach could lead to the use of a less effective dressing, resulting in prolonged healing times, increased healthcare utilization, and potentially poorer patient outcomes, which is both ethically and professionally unsound. The professional decision-making process for similar situations should involve a structured approach. 1. Conduct a thorough and objective wound assessment, documenting all findings. 2. Identify the primary goals of wound management, e.g., debridement, infection control, exudate management, moisture balance, protection. 3. Consider the characteristics of the wound bed, exudate, and peri-wound skin. 4. Review available dressing options and their properties, indications, and contraindications. 5. Select the dressing that best meets the identified goals and addresses the wound's specific needs, considering patient factors and potential barriers. 6. Document the rationale for the dressing selection. 7. Plan for regular reassessment and adjustment of the treatment plan as the wound evolves. Question 14. During the evaluation of a chronic non-healing wound, which of the following best reflects the understanding of extracellular matrix echem components and their critical roles in facilitating wound repair? Option A. Focusing exclusively on the role of hyaluronic acid in providing a hydrated environment, as this is the sole determinant of successful ECM formation. Option B. Prioritizing interventions that support fibronectin's role in cell adhesion and migration, collagen's contribution to structural integrity, and glycosaminoglycan's function in hydration and signaling. Option C. Assuming that the presence of any ECM component indicates sufficient structural support, and that no further intervention is needed for matrix remodeling. Option D. Emphasizing the degradation of all ECM components to clear the wound bed, regardless of their stage-specific function. The correct answer is B. Prioritizing interventions that support fibronectin's role in cell adhesion and migration, collagen's contribution to structural integrity, and glycosaminoglycan's function in hydration and signaling. Explanation. This scenario is professionally challenging because accurately assessing the role of extracellular matrix echem components in wound healing requires a nuanced understanding of their complex interactions and the specific physiological context of the wound. Misinterpreting these roles can lead to suboptimal treatment strategies, potentially delaying healing or exacerbating complications. The correct approach represents best professional practice because it aligns with evidence-based wound care principles and the established understanding of ECM's multifaceted contributions to wound repair, specifically recognizing that fibronectin plays a crucial role in cell adhesion and migration, collagen provides structural integrity and tensile strength, and glycosaminoglycans GAG contribute to hydration and cell signaling, allows for targeted interventions. For instance, understanding fibronectin's role might guide the selection of dressings that promote cell migration, while knowledge of collagen's importance would inform strategies to support collagen synthesis and organization. This approach is ethically sound as it prioritizes patient well-being by employing the most effective and scientifically supported methods for wound management. Incorrect approaches fail to demonstrate this comprehensive understanding. Focusing solely on one ECM component without considering its interaction with others, or assuming a single component is the primary driver of healing, oversimplifies a complex biological process. This can lead to interventions that are ineffective or even detrimental. For example, solely focusing on GAGs without addressing the structural deficits caused by inadequate collagen deposition would neglect a critical aspect of wound repair. Such an approach could be considered negligent as it deviates from accepted standards of care and fails to adequately address the patient's needs based on a thorough understanding of wound physiology. The professional reasoning process for similar situations should involve a systematic evaluation of the wound's current healing phase, the patient's overall health status, and the specific contributions of various ECM components to that phase. This requires continuous learning and staying abreast of current research in wound healing. When faced with a complex wound, professionals should ask, what is the primary impediment to healing in this specific wound, and how do the known functions of ECM components relate to this impediment? This analytical framework, grounded in scientific understanding and patient-centered care, guides the selection of appropriate diagnostic tools and therapeutic interventions. Question 15. Operational review demonstrates that a patient presents with a wound characterized by a granulating bed, moderate to heavy serosanguinous exudate, and intact periwound skin. The primary goal of wound management is to promote autolytic debridement and maintain a moist healing environment. Considering the available advanced dressing options, which dressing selection would be most appropriate based on these wound characteristics and the goal of care? Option A, a hydrogel dressing. Option B, a hydrocolloid dressing. Option C, an alginate dressing. Option D, a foam dressing. The correct answer is B, a hydrocolloid dressing. Explanation: scenario analysis. This scenario presents a common challenge in wound care, selecting the most appropriate advanced dressing for a specific wound type and patient condition. The professional challenge lies in balancing the theoretical benefits of different advanced dressings with the practical realities of patient needs, cost-effectiveness, and adherence to evidence-based practice guidelines, all within the regulatory framework governing wound care product selection and reimbursement. Misapplication of dressings can lead to delayed healing, increased patient discomfort, and potential complications, necessitating careful, informed decision-making. Correct approach analysis. The correct approach involves a comprehensive assessment of the wound bed characteristics, exudate levels, and surrounding skin integrity. For a wound with moderate to heavy exudate and a need for autolytic debridement, a hydrocolloid dressing is often a suitable choice. Hydrocolloids form a gel in contact with wound exudate, creating a moist healing environment conducive to autolytic debridement, protecting the periwound skin from maceration, and providing a barrier against bacterial contamination. Their semi-occlusive nature also helps to manage exudate by absorption. This selection aligns with best professional practice by prioritizing patient outcomes and evidence-based wound management principles. Regulatory frameworks typically support the use of dressings that promote optimal healing and patient safety, and the selection of a hydrocolloid for these specific wound characteristics would be consistent with such guidelines. Incorrect approaches analysis. Choosing a hydrogel for a wound with heavy exudate would be an incorrect approach. Hydrogels are primarily water-based and are best suited for dry to minimally exuding wounds, where they provide moisture to promote autolytic debridement. In a heavily exuding wound, a hydrogel would likely become saturated, leading to maceration of the periwound skin and potentially increasing the risk of infection. This would represent a failure to adhere to evidence-based practice and could be considered a deviation from professional standards of care, potentially leading to adverse patient outcomes. Selecting an alginate for a dry wound would also be an incorrect approach. Alginates are highly absorbent and are designed for wounds with moderate to heavy exudate. They form a hydrophilic gel upon contact with wound fluid, which aids in absorption and can be beneficial for debridement. However, in a dry wound, an alginate would absorb any available moisture, potentially leading to desiccation of the wound bed and hindering healing. This misapplication would fail to create an optimal healing environment and could be seen as a breach of professional responsibility to select the most appropriate dressing for the wound's specific needs. Opting for a foam dressing on a wound with minimal exudate in a dry wound bed, without specific indications for its use, e.g., pressure relief or protection, would also be an incorrect approach. While foam dressings are versatile and can manage moderate exudate, they are not the primary choice for dry wounds. Their absorbent properties might be excessive, potentially leading to drying out the wound bed. Furthermore, the cost-effectiveness of using a more absorbent dressing than necessary could be questioned, and if it leads to suboptimal healing, it could be viewed as a failure to provide cost-effective care within a regulated healthcare system. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough wound assessment. This assessment should include evaluating the wound bed, e.g., granulation, slough, eschar, exudate amount and type, periwound skin condition, presence of infection and patient factors, e.g., allergies, mobility, pain. Following the assessment, professionals should consult current evidence-based practice guidelines and product information to identify dressings that are indicated for the specific wound characteristics. Consideration of patient comfort, ease of application, cost, and potential for adverse reactions is also crucial. In situations involving advanced dressings, understanding the mechanism of action and indications for each type, hydrocolloids for moderate exudate and autolytic debridement, hydrogels for dry wounds, alginates for heavy exudate, and foams for moderate exudate and cushioning, is paramount. This structured approach ensures that the chosen dressing optimizes the healing environment, minimizes complications, and aligns with regulatory expectations for quality patient care. Question 16. The risk matrix shows a moderate risk of infection and a high risk of delayed healing due to significant slough and eschar in a lower extremity wound on an elderly patient with peripheral vascular disease and moderate pain. The patient has limited mobility and a history of poor adherence to complex dressing regimens. Considering these factors, which debridement technique would be the most appropriate initial approach to manage the non-viable tissue while minimizing patient discomfort and potential complications? Option A, mechanical debridement with a hydroabrasive device. Option B, autolytic debridement utilizing an appropriate occlusive dressing. Option C, enzymatic debridement with a broad-spectrum enzyme ointment. Option D, surgical debridement by a vascular surgeon. The correct answer is B, autolytic debridement utilizing an appropriate occlusive dressing. Explanation: this scenario presents a common clinical challenge where multiple debridement techniques are potentially applicable to a complex wound. The professional challenge lies in selecting the most appropriate method based on the patient's overall condition, the wound characteristics, and the potential risks and benefits of each approach, all within the established scope of practice for a certified wound specialist. Careful judgment is required to balance efficacy, patient comfort, cost-effectiveness, and adherence to best practices and regulatory guidelines. The correct approach represents best professional practice because it prioritizes patient safety and optimal wound healing outcomes. Autolytic debridement, when appropriate, leverages the body's own enzymes to break down non-viable tissue, offering a gentle and cost-effective method that minimizes patient discomfort and preserves viable tissue. This aligns with the ethical principle of beneficence and the regulatory expectation of providing evidence-based care. An enzymatic debridement approach, while effective, may be less ideal in this specific scenario if the wound bed is already demonstrating signs of autolytic activity, or if there are concerns about potential enzymatic degradation of healthy tissue or increased cost without a clear advantage over autolytic methods. Regulatory failure would occur if the choice was based on convenience or cost savings, without a thorough assessment of its suitability for the specific wound type and patient. A mechanical debridement approach, particularly aggressive forms like wet-to-dry dressings, carries a significant risk of damaging healthy granulation tissue, causing pain, and potentially introducing infection. Regulatory and ethical failures would arise from using such a method when less traumatic alternatives are available and indicated, violating the principle of non-maleficence and potentially contravening guidelines that advocate for atraumatic wound care. A surgical debridement approach, while definitive for removing large amounts of necrotic tissue, is invasive and carries risks of bleeding, infection, and pain. If less invasive methods like autolytic or enzymatic debridement are sufficient for managing the current level of non-viable tissue, and the patient is not hemodynamically unstable or at immediate risk of sepsis, then opting for surgical debridement, without exhausting these alternatives, would represent a failure to provide the least restrictive, most appropriate care, potentially violating ethical and regulatory standards for resource utilization and patient well-being. The professional decision-making process should involve a comprehensive wound assessment, including the type and amount of non-viable tissue, wound bed characteristics, exudate levels, patient's comorbidities, pain tolerance, and available resources. This assessment should then be used to evaluate the risks and benefits of each debridement modality, considering current evidence-based guidelines and the certified wound specialist's scope of practice. The chosen method should be the one that most effectively and safely removes non-viable tissue while promoting a healthy wound environment and minimizing patient distress. Question 17. Regulatory review indicates that a certified wound specialist is managing a stage Roman II pressure injury with moderate exudate and intact peri-wound skin. The specialist is considering various dressing options to promote moist wound healing. Which of the following approaches represents the most appropriate risk assessment and management strategy? Option A. Select a highly absorbent hydrofiber dressing to manage the moderate exudate and protect the peri-wound skin. Option B. Utilize a transparent film dressing to maintain a moist environment and allow for visual monitoring of the wound. Option C. Apply a non-adherent gauze dressing to allow for frequent inspection and minimize disturbance to the wound bed. Option D. Choose a hydrocolloid dressing that provides a moist environment and absorbs minimal to moderate exudate, while also offering protection to the peri-wound skin. The correct answer is A. Select a highly absorbent hydrofiber dressing to manage the moderate exudate and protect the peri-wound skin. Explanation. Scenario analysis. This scenario presents a common clinical challenge in wound care, balancing the principles of moist wound healing with the potential for maceration and infection. The professional challenge lies in accurately assessing the wound environment and selecting an appropriate dressing that promotes healing without causing iatrogenic harm. This requires a nuanced understanding of wound exudate management and the properties of various dressing materials, all within the scope of practice and regulatory guidelines for a certified wound specialist. Correct approach analysis. The correct approach involves a comprehensive risk assessment of the wound's exudate level and the surrounding skin integrity. A dressing that effectively manages moderate to heavy exudate while protecting the peri-wound skin from moisture-associated damage is indicated. This aligns with the principle of maintaining a moist wound environment conducive to cell migration and proliferation, while simultaneously preventing the adverse effects of excessive moisture, such as maceration and increased risk of infection. Best professional practice dictates a proactive, evidence-based approach that prioritizes patient safety and optimal healing outcomes, adhering to established clinical guidelines and the scope of practice for wound specialists. Incorrect approach is analysis. Applying a simple, non-absorbent dressing to a wound with moderate exudate fails to manage the moisture effectively, leading to a suboptimal healing environment and potential maceration. This neglects the core principle of exudate management in moist wound healing and could be considered a deviation from best practice, potentially violating standards of care if it leads to adverse outcomes. Using a highly absorbent dressing on a wound with minimal exudate can lead to desiccation, hindering cell migration and delaying healing. This demonstrates a misunderstanding of exudate levels and dressing selection, potentially causing harm by creating an overly dry wound bed. Ignoring the peri-wound skin assessment and applying a dressing without considering its potential impact on surrounding tissues is a critical oversight. Excessive moisture or inappropriate dressing adherence can lead to skin breakdown, increasing the risk of infection and pain, which is contrary to the principles of holistic wound care and patient well-being. Professional reasoning. Professionals should approach this situation by first conducting a thorough wound assessment, including exudate volume, wound bed characteristics, and peri-wound skin condition. This assessment should then inform the selection of a dressing that supports the principles of moist wound healing while mitigating risks. Decision-making should be guided by evidence-based practice, institutional policies, and the certified wound specialist's scope of practice, always prioritizing patient safety and optimal outcomes. Regular reassessment of the wound and dressing effectiveness is crucial for ongoing management. Question 18. Benchmark analysis indicates that a certified wound specialist is managing a patient with a chronic non-healing wound. The specialist has thoroughly assessed the wound and determined that negative pressure wound therapy, NPWT, is the most evidence-based and appropriate treatment to promote healing. However, the patient expresses a strong preference for a different, less conventional treatment modality they read about online, citing personal beliefs and a desire to avoid the perceived discomfort of NPWT. The specialist has explained the benefits and risks of NPWT, but the patient remains hesitant. What is the most ethically and professionally sound course of action for the certified wound specialist in this situation? Option A. Engage in a detailed, empathetic discussion with the patient to understand their reservations about NPWT. Provide comprehensive evidence-based information about both NPWT and the patient's preferred modality, including its limitations and risks, and collaboratively explore all treatment options to reach a shared decision that respects the patient's autonomy while prioritizing safe and effective care. Option B. Proceed with the patient's preferred treatment modality without further discussion, as patient autonomy dictates that their wishes must always be honored, regardless of clinical evidence or professional recommendation. Option C. Agree to the patient's preferred treatment without thoroughly investigating its efficacy or potential risks, prioritizing patient satisfaction over evidence-based practice to avoid conflict. Option D. Insist on initiating NPWT immediately, explaining that as the expert, their recommendation is final and the patient must comply for their own good. disregarding the patient's expressed preferences. The correct answer is A. Engage in a detailed, empathetic discussion with the patient to understand their reservations about NPWT. Provide comprehensive evidence-based information about both NPWT and the patient's preferred modality, including its limitations and risks, and collaboratively explore all treatment options to reach a shared decision that respects the patient's autonomy while prioritizing safe and effective care. Explanation. Scenario analysis. This scenario presents an ethical dilemma where a certified wound specialist, CWS, must balance patient autonomy, the principle of beneficence, and the practical limitations of available resources and established clinical protocols. The patient's expressed preference for a specific, potentially less evidence-based treatment modality for their chronic wound, despite the CWS's recommendation for negative pressure wound therapy, NPWT, creates a conflict. The challenge lies in respecting the patient's right to make informed decisions about their care, while ensuring they receive treatment that aligns with best practices and regulatory expectations for wound management. Correct approach analysis. The correct approach involves a thorough, patient-centered discussion that prioritizes informed consent and shared decision-making. This includes clearly explaining the rationale behind recommending NPWT, detailing its evidence-based benefits for the patient's specific wound type, and addressing any potential risks or contraindications. Crucially, it also involves actively listening to and understanding the patient's concerns, fears, or reasons for preferring the alternative treatment. The CWS must then explore these concerns, provide accurate information about the alternative, and collaboratively develop a treatment plan that, if possible, incorporates the patient's preferences while remaining within the bounds of safe and effective care. This aligns with ethical principles of autonomy and beneficence, and regulatory expectations that mandate patient education and involvement in treatment decisions. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's preference outright and unilaterally impose the recommended NPWT without further discussion or exploration of their concerns. This violates the principle of patient autonomy and can erode trust, potentially leading to non-adherence. Ethically, it fails to uphold the patient's right to informed consent and shared decision-making. Regulatory frameworks often emphasize patient-centered care and the right to refuse treatment after being fully informed. Another incorrect approach would be to agree to the patient's preferred treatment without adequately assessing its suitability or potential risks, or without ensuring the patient fully understands why NPWT is considered the superior option. This could be seen as a failure of beneficence, as the CWS would not be acting in the patient's best interest by potentially offering a less effective or even harmful treatment. This also fails to meet regulatory expectations for providing evidence-based care and ensuring patient safety. A third incorrect approach might involve pressuring the patient into accepting NPWT through subtle coercion or by withholding information about the alternative. This is ethically unacceptable, as it undermines informed consent and manipulates the patient's decision-making process. It also contravenes regulatory guidelines that prohibit deceptive practices and mandate transparent communication. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making process. First, they must identify the core ethical conflict and relevant professional standards. Second, they should gather all necessary information, including the patient's history, wound characteristics, and the evidence supporting different treatment modalities. Third, they must engage in open and honest communication with the patient, actively listening to their concerns and providing clear, unbiased information. Fourth, they should explore all viable options, seeking to find a mutually agreeable plan that respects patient autonomy while upholding professional responsibilities for safety and efficacy. If a patient's chosen treatment is demonstrably unsafe or ineffective, the professional must clearly articulate these concerns and explore alternatives, documenting the entire process thoroughly. Question 19. Market research demonstrates a growing interest in advanced wound care modalities, including the application of growth factors and cytokines. A certified wound specialist is evaluating the most appropriate strategy for incorporating these biological agents into their practice to optimize wound healing outcomes. Which of the following approaches best reflects a commitment to evidence-based practice and regulatory compliance? Option A. Implementing the use of growth factors and cytokines based on the most persuasive marketing materials provided by manufacturers, assuming their products are generally safe and effective. Option B. Prioritizing the use of growth factors and cytokines that have demonstrated statistically significant positive outcomes in multiple, high-quality, peer-reviewed clinical trials and are approved by regulatory bodies for specific wound indications. Option C. Focusing on growth factors and cytokines that are readily available and cost-effective, with less emphasis on the specific evidence of efficacy for individual wound types. Option D. Adopting novel or experimental applications of growth factors and cytokine that show preliminary promise in case studies, even if not yet widely published or regulatory approved for those specific uses. The correct answer is B. Prioritizing the use of growth factors and cytokines that have demonstrated statistically significant positive outcomes in multiple, high-quality, peer-reviewed clinical trials and are approved by regulatory bodies for specific wound indications. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified wound specialist, CWS, by requiring them to evaluate the optimal application of growth factors and cytokines in wound healing, considering both efficacy and regulatory compliance. The challenge lies in discerning the most evidence-based and ethically sound approach when faced with potentially conflicting information or novel application, ensuring patient safety and adherence to professional standards. The CWS must navigate the complexities of biological agents, their mechanisms of action, and the regulatory landscape governing their use in clinical practice. Correct approach analysis. The correct approach involves a thorough review of current, peer-reviewed scientific literature and established clinical guidelines specifically pertaining to the use of growth factors and cytokines in wound management. This aligns with the CWS's commitment to evidence-based practice, a cornerstone of professional responsibility. By prioritizing research that demonstrates a clear benefit-risk profile and adherence to regulatory approvals for specific indications, the CWS ensures that patient care is guided by the most reliable and safe information available. This approach upholds the ethical obligation to provide competent care and the professional standard of staying abreast of advancements in the field, ensuring that interventions are both effective and legally permissible within the defined regulatory framework for wound care products. Incorrect approaches analysis. One incorrect approach would be to rely solely on anecdotal evidence or marketing claims from manufacturers. This is professionally unacceptable because it bypasses the rigorous scientific validation required for medical interventions. Such an approach risks patient harm due to unproven efficacy or unforeseen side effects and violates the ethical duty to provide care based on sound scientific principles. Furthermore, it may contravene regulatory guidelines that mandate the use of approved and evidence-based treatments. Another incorrect approach would be to adopt a novel or off-label use of growth factors or cytokines without robust supporting research or explicit regulatory approval for that specific indication. While innovation is important, it must be balanced with patient safety and regulatory compliance. Proceeding without adequate evidence or approval exposes the patient to unknown risks and could lead to legal and ethical repercussions for the practitioner, as it deviates from established standards of care and regulatory oversight. A third incorrect approach would be to disregard the potential for adverse effects or contraindications associated with growth factors and cytokines. These biological agents, while beneficial, can have side effects or may not be suitable for all patient populations or wound types. A failure to consider these factors demonstrates a lack of comprehensive understanding and a disregard for patient safety, which is a fundamental ethical and professional failing. Professional reasoning. Professionals should approach decisions regarding the use of growth factors and cytokines by first establishing the patient's specific wound characteristics and needs. This is followed by a comprehensive search for high-quality, peer-reviewed evidence supporting the use of specific agents for that particular wound type and stage. Concurrently, the CWS must verify that the chosen agent is approved by the relevant regulatory bodies for the intended use. If considering off-label use, a thorough risk-benefit analysis, consultation with peers or specialists, and informed patient consent are paramount. The decision-making process should always prioritize patient safety, evidence-based practice, and adherence to all applicable regulations and ethical guidelines. Question 20. Implementation of a comprehensive patient history and physical examination for a patient with a chronic non-healing wound reveals a significant cultural preference for using a specific herbal poultice, which the patient believes is superior to the prescribed advanced wound dressing. The patient expresses strong resistance to the prescribed dressing, citing deeply held family traditions and a lack of trust in conventional medical treatments for this particular condition. The certified wound specialist is faced with the ethical challenge of respecting the patient's autonomy while ensuring the best possible outcome for the wound. Which of the following approaches best upholds professional standards and ethical obligations? Option A. Document the patient's refusal of the prescribed dressing and the preference for the herbal poultice, and then terminate care, advising the patient to seek care elsewhere if they cannot adhere to the recommended treatment. Option B. Proceed with applying the prescribed advanced wound dressing as per the treatment plan, as the clinician's professional judgment based on evidence takes precedence over patient preference in cases of potential harm. Option C. Agree to the patient's request to use the herbal poultice exclusively, as respecting patient autonomy and cultural beliefs is paramount, even if it means deviating from evidence-based practice. Option D. Gently but firmly explain the evidence-based superiority of the prescribed dressing. Explore the patient's specific concerns about the poultice and the prescribed dressing, and collaboratively seek a compromise or alternative that respects the patient's beliefs while aiming for optimal wound healing. The correct answer is D. Gently but firmly explain the evidence-based superiority of the prescribed dressing. Explore the patient's specific concerns about the poultice and the prescribed dressing, and collaboratively seek a compromise or alternative that respects the patient's beliefs while aiming for optimal wound healing. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in wound care where a patient's personal beliefs or cultural practices may conflict with standard medical recommendations for wound management. The challenge lies in balancing the clinician's professional responsibility to provide evidence-based care with the patient's autonomy and right to self-determination. Failure to navigate this conflict ethically can lead to patient dissatisfaction, non-adherence, and potentially compromised wound healing, while also risking regulatory or professional censure. Correct approach analysis. The correct approach prioritizes open communication, patient education, and collaborative decision-making. It acknowledges the patient's right to refuse treatment and seeks to understand the underlying reasons for their preference. By exploring alternatives that align with the patient's beliefs while still aiming for optimal wound healing, the clinician upholds ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for autonomy. This aligns with professional guidelines that emphasize patient-centered care and shared decision-making, ensuring that treatment plans are not only medically sound, but also culturally sensitive and acceptable to the patient. Incorrect approaches analysis. One incorrect approach involves overriding the patient's wishes and proceeding with the prescribed treatment without further discussion. This violates the principle of patient autonomy and informed consent, which are fundamental ethical and regulatory requirements. It can be construed as paternalistic and may lead to a breakdown in the therapeutic relationship. Another incorrect approach is to dismiss the patient's concerns as unfounded or irrelevant and to terminate care. This demonstrates a lack of empathy and professional responsibility. While a clinician is not obligated to provide care against their professional judgment, abandoning a patient without ensuring continuity of care or offering appropriate referrals is ethically and professionally unacceptable. It fails to uphold the duty of care and can leave the patient vulnerable. A third incorrect approach is to agree to the patient's request without adequately assessing the risks or exploring safer alternatives. This compromises the principle of beneficence by potentially exposing the patient to ineffective or harmful practices, even if they align with the patient's immediate wishes. It neglects the clinician's responsibility to provide evidence-based care and to educate the patient about potential consequences. Professional reasoning. Professionals should approach such dilemmas by first actively listening to and validating the patient's concerns. This involves creating a safe space for open dialogue. Next, the clinician should clearly and empathetically explain the rationale behind the recommended treatment, including the evidence supporting its efficacy and the potential risks of not following it. Simultaneously, the clinician should inquire about the patient's beliefs and the reasons for their preferences, seeking to understand their perspective. The goal is to collaboratively explore alternative strategies that can achieve the desired therapeutic outcomes while respecting the patient's values and cultural background. If a mutually agreeable plan cannot be reached, The professional should discuss the implications of proceeding with the patient's preferred method, and if necessary, explore options for referral to another provider or facility that may be better equipped to meet the patient's needs.